Hello everyone, and welcome back. Today we're discussing an important topic in pharmacology and nutrition: effects of food on drug therapy. Many people think medicines work the same way regardless of what they eat. However, food can significantly influence how a drug is absorbed, distributed, metabolized, and excreted from the body. These interactions can increase drug effectiveness, reduce therapeutic effects, or even cause toxicity. Let's explore how food affects each stage of a drug's journey through the body. Food and drug absorption. Absorption is the movement of a drug from its site of administration into the bloodstream. Food can affect absorption in several ways: delaying gastric emptying. A meal, especially one rich in fat, slows stomach emptying. As a result, drugs remain in the stomach longer and reach the small intestine more slowly. Example: pain relievers such as paracetamol may have a slower onset of action when taken after a large meal. Enhancing drug absorption. Some drugs dissolve better in the presence of dietary fats. Example: fat-soluble medications may achieve higher blood concentrations when taken with food. Reducing drug absorption. Certain nutrients can bind to drugs and prevent their absorption. Examples: calcium in milk can bind to some antibiotics. Iron supplements can decrease absorption of certain medications. Altering gastric pH. Food changes stomach acidity, which can affect drug dissolution and absorption. Key message: food may increase, decrease, delay, or have no effect on drug absorption depending on the medication. Food and drug distribution. After absorption, drugs are distributed through the bloodstream to tissues and organs. Effects on plasma protein binding. Many drugs bind to blood proteins, particularly albumin. Poor nutritional status and protein deficiency can reduce albumin levels. As a result, more unbound drug remains in circulation. Drug activity increases. Risk of toxicity may rise. Effects on body composition. Nutrition influences body fat and body water. Since some drugs are fat-soluble while others are water-soluble, changes in body composition can alter drug distribution and duration of action. Key message: nutritional status influences how drugs travel and where they are stored within the body. Food and drug metabolism. Metabolism refers to the chemical transformation of drugs, primarily in the liver. Food can alter liver enzyme activity and therefore affect drug metabolism. Enzyme inhibition. Some foods slow the activity of drug metabolizing enzymes. Example: grapefruit juice inhibits certain liver and intestinal enzymes. This may cause increased drug concentrations, enhanced effects, greater risk of adverse reactions. Enzyme induction. Certain dietary components and herbal products can increase enzyme activity. This can accelerate drug metabolism, reduce drug concentration, lower therapeutic effectiveness. Effects of nutritional status. Malnutrition may impair liver function and reduce drug metabolism, leading to prolonged drug action. Key message: food can either increase or decrease the rate at which drugs are metabolized. Food and drug excretion. Excretion is the removal of drugs from the body, mainly through the kidneys. Hydration status. Adequate fluid intake supports kidney function and drug elimination. Dehydration may slow drug excretion, increase drug accumulation, raise toxicity risk. Changes in urinary pH. Certain foods can alter urine acidity or alkalinity. Changes in urinary pH may increase drug excretion, decrease drug excretion, affect drug half-life. Electrolyte balance. Dietary intake of sodium, potassium, and other electrolytes can influence the elimination and effects of some medications. Key message: food and fluid intake play important roles in determining how efficiently drugs are eliminated from the body. Clinical importance of food-drug interactions. Food-drug interactions may result in reduced drug absorption, increased toxicity, delayed therapeutic response, treatment failure, nutrient deficiencies. Therefore, healthcare professionals should always consider dietary habits when prescribing medications. Patients should also follow instructions such as take with food, take on an empty stomach, avoid specific foods or beverages. These recommendations are based on scientific evidence designed to optimize treatment outcomes. Conclusion. To summarize, food can influence every phase of drug therapy. Absorption. Food may enhance, delay, or reduce drug uptake. Distribution. Nutritional status affects protein binding and tissue distribution. Metabolism. Foods can alter liver enzyme activity and drug breakdown. Excretion. Diet and hydration affect drug elimination through the kidneys. Understanding these interactions helps maximize therapeutic benefits while minimizing adverse effects. Thank you for watching. If you found this lecture helpful, please like, share, and subscribe for more pharmacology and nutrition content. See you in the next lecture.